In health news tonight, a new tool to detect one of the fastest growing diseases likely linked to obesity.
We're talking about fatty liver disease. News 8's medical reporter Jocelyn Mementa in our New Haven newsroom tonight with more on how doctors at Hartford Hospital are using new technology to help manage the increasing number of cases. Jocelyn?
And Darren, this type of liver disease is similar to alcoholic liver disease, but this one occurs in people who drink little or no alcohol. They're detecting it in more patients, likely due to more people with obesity. Now there's a new way to scan the liver for it.
So we're going to take a look and see if there's any scar tissue on the liver.
Stuart Nolan is now seeing a fair amount of doctors.
I hadn't been to the doctor in approximately 25 years.
But that changed after getting a serious scare.
I'm not a sickly person, and I always felt well, and it just was terrible. It knocked me down for like 3 days.
That led to the discovery Stuart has a fatty liver.
Fatty liver disease is becoming the most common liver disease that we see.
Increasing in part due to obesity.
So we're going to take a look and see if there's any scar tissue on the liver.
Dr. Michael Einstein, who specializes in liver disease, is monitoring what's going on in Stuart's liver.
And you're going to feel a little pulse.
This new diagnostic tool is what confirmed the diagnosis after it scanned for scar tissue.
Unlike a liver biopsy, which takes a little sample, this sample's a larger piece of the liver.
It uses ultrasound technology covering a bigger area, providing more information. There's a 1-2 punch of energy waves, then instant results.
The faster that the sound wave moves through, the more scar tissue and disease there is in the liver. We have to do it 10 times to get a good reading.
This non-invasive option allows some patients to avoid the more uncomfortable biopsy.
If I do this and their labs, their Fibroscan all look normal and I'm not concerned that there's significant scar tissue, I won't biopsy them. Come on up.
Unfortunately for Stuart, he still needed the biopsy.
I feel better knowing what's going on with me.
In his case, the fatty buildup in his liver led to an inflammation of the cells and the scarring.
Between his biopsy, the Fibroscan, and labs, I'm going to treat him as though he has cirrhosis, and I'll do periodic imaging of his liver to make sure that he doesn't have cancer.
Dr. Einstein says the best way to avoid the fatty liver disease is to manage the risk factors. That includes diabetes, high blood pressure, cholesterol, and weight loss. Darren and Ann?
Jocelyn, thanks.